So, ministers, director, dear guests, I'm going to talk about health and well-being as a matter of the heart, meaning, of course, what matters the most. And I emphasize this with these pictures of hearts from Icelandic nature taken by a friend of mine. In this short talk, I'm going to give my simplified view on healthcare after working as an intensive care physician for over 30 years. And taking care of the sickest patients there are, I realized that intensive care units do too much, too late to too few. And I also learned that an ounce of prevention is better than a pound of cure. So I studied public health and now serve as a director where public health is a great deal of my job. Lastly, I'm going to talk about economy that I know absolutely nothing about, but please bear with me. So here we see what Icelanders value the most for own quality of life. Not surprisingly, health and relationships are at the top. And we also know that people, or most people, rank happiness and well-being over money as a life goal. And these are the many so-called determinants of health and well-being, and it's said that health develops in our everyday life. So what matters are lifestyle, how we live our lives. It's about living conditions in general and about the socio-economic environment. But healthcare services also matter. And we face some severe challenges in healthcare services. One is increased demand and cost in a financially pressed environment. This is due to aging, which is positive, of course, but also due to more chronic illnesses, mental cancer, diabetes, and so forth. As our panel just discussed, we face severe shortage of healthcare personnel. The services become more and more complicated, as does the expectations of the users. We are still dealing with the aftermath of COVID-19. We face antibiotic resistance and climate change that has been declared the single biggest health threat facing humanity. And on top of everything, we have war with migration and some horrendous consequences. So obviously, healthcare is not sustainable as it is. But what can we do about it? Well, I think we should emphasize two things. Of course, I'm simplifying a very, very complicated matter, but a very important thing is to increase the effectiveness of health expenditures by optimizing use and delivery of healthcare. And I have the same equation as our economist showed this morning, with value is health divided by cost. So we should aim at getting as much health as possible for the money. And when I was chief of ICU, it was much more practical for me to try to increase quality and reduce waste. And by waste, we mean activity in healthcare that does not improve patient care or outcomes. And OECD has estimated that this could be as much as 15% of the healthcare budget. So it's a lot to win there. And also, care that is of high quality costs less than bad care. And then we should use innovation, new technologies, and so forth. And secondly, we should promote public health. And we also see many challenges when it comes to public health. People eat unhealthy diet, they sleep too little, and they exercise too little. And this contributes to chronic illnesses like obesity and diabetes. We see worsening mental health, growing anxiety, stress, and loneliness, and not least among the younger people. We use too much drugs, and we also see drug addiction rising. And then even if Iceland is the most equal country in the world, we see gender and social inequalities. For example, women in Iceland, they spend more years in ill health. But what can we do? I think we should go back to basics, and through education and improved health literacy, we should promote healthy lifestyle. And we all know what we need to do. We need to eat healthy, we need to exercise, we need to sleep enough, we need to take care of our mental health and stay away from alcohol and tobacco. And if we do that, maybe, or at least we can increase our chances at being in good health at 95, like my mother here. This picture was taken in her birthday party. It was a coincidence that we were dressed the same. And now people say that I dress like a 95-year-old. And today she's almost 100 and still going strong. So back to the basics with health promotion. But we should also look into the future. And hopefully we will get some solutions there. We need research and new knowledge on what works in public health. WHO, for example, is stressing behavioral and cultural insights now, which I think is very valuable. And we see new technologies on the horizon, like new types of screening, use of genetic science, artificial intelligence, and so forth. But last but not least, we should do more public health assessments and put health in all policies. We need to measure and monitor the right things, and I think we are on the right track to focus on well-being economy. And of course, these economic indicators were extremely important in the early stages of economic development. And money is a means to the end of well-being. However, the more prosperous a society becomes, money matters less for well-being and happiness. And we can see that economic output increases, but there is no rise in life satisfaction or well-being. And that's because that well-being depends on so many other factors. And when it comes to money and happiness, when people have little, money, of course, increases happiness. That's easy to see in reference with the Maslow triangle. But we know that financial difficulties cause stress and contribute to mental health problems. And making difficulties in making ends meet is one of our public health indicators here in Iceland, and we see a correlation there with less happiness. Then when people get more money, the relationships blunt and then disappears. And there are even indications to the contrary that too much focus on materialism and wealth decreases well-being. And when it comes to countries, the picture is less clear and there is more variation. As we see here on the left-hand side, there we see GDP of different countries plotted against life satisfaction. And our economist here this morning told us that life satisfaction is one of the best indicators. And he also told us that well-being is a good, or life satisfaction and well-being is a good predictor of voting for the existing governments. Do you remember that? So that's why our ministers are pushing this, I asked Catherine. But you see there that the curve, it levels off, and we know that there are so many other things that are meaningful for the well-being of a whole nation: freedom, governance, peace, and trust. And on the left-hand side, we see a graph from USA showing this steep rise in GNP, but life satisfaction does not rise. And we also know that people suffer from more depression and anxiety, and there is great distrust in the society. So it seems like economic growth has topped in its capacity to produce more well-being in developed nations. So then an obvious question from a novice like myself is, so why aim at more economic growth than it is needed, especially in light of global warming? So if somebody can answer that question, I would be happy to hear. So instead, we should aim at well-being, and there are so many advantages of well-being for society, for work, as Neil Gray talked about this morning and has been mentioned some times here today. And it's also very important for the individual and affects both mental and physical health. And I think WH Europe captures the essence of well-being economy when it says that put people at the heart of decision-making processes and share the goal of well-being to create prosperous, sustainable, and fair societies for current and future generations. So, of course, we should focus spending and investment towards improved population health, both physical and mental, societal well-being, and equity. And I like to cite this paper. It's a study from Wales on well-being economy, and the second author is Chris Brown, who was chairman in the previous session. And they say that the misperception of the healthcare sector as an economic drain rather than a powerful stabilizer and investment multiplier should be challenged. So here to that. So to conclude, I think Iceland has a unique opportunity to be the best in public health and to be a great well-being state. We have excellent results in many areas of healthcare services and public health. We are a prosperous nation. We have good conditions when it comes to public health, clean air and water and so on. We are well-educated and well-informed nation. We have excellent healthcare and public health personnel. We are a small and still relatively young nation. We know that high-level political commitment is needed, and we see that here today that is already in place in Iceland. And it was very enjoyable to get this deep dive report from WHO that states that the well-being economy is taking shape in Iceland. But we need to continue with international collaboration on well-being economy, and I look very much forward to see you all here next year. We need to try to define what it is, to define the metrics, and to share best practices. And if we can not do it here in Iceland, then who? So thank you very much for your attention.